Well, poverty is normally measured in terms of people's income, and you set a poverty line. But poverty is so much more than that. It's poor quality housing, it's lack of access to safe, sufficient water, often no toilet in the house, lack of access to education, to healthcare, to the rule of law very often. Living in informal settlements, it's rarely that you get policing. And even lack of voice. Living in an informal settlement, you often don't get on the voters' register. So these are all critical elements of poverty. The other reason it's useful to distinguish these from income is that many of these are things that government can act on, especially local government. Local government probably hasn't got much power to increase the income of the poorest groups, but it can make sure they have safer housing, water, sanitation, drainage, healthcare, schools, voice, and the rule of law. So the other dimensions of poverty can be identified because they're more easily acted on.
The idea of poverty itself largely comes from an agrarian context, where the key thing is to try and deal with calorie poverty or food security, basically dealing with hunger. And the way it's been typically sort of assessed across much of the world is allowing everybody to have at least 3 square meals a day. And given that the share of food-based expenditure sort of declines as your income goes up and your urbanization goes up, the big question then is how does that work in cities? So the two things that are there. One, of course, is that typically in cities food is more expensive, so you might find at the same level of income or at the same poverty line that cities would typically have a larger proportion of poverty than rural areas, because by and large people are buying their food. There's very little self-production. But more important, there are a whole range of other things that people have to invest in. They usually have to travel for work, so there's a cost of travel, which if it's it's fueled by fossil fuel, and oil is now at $100 a barrel, becomes a difficult thing to deal with. And then there's the cost of water supply, sanitation, and housing. And where land markets are exclusionary, it makes it very difficult. So people have to live in informal settlements. Their lives are quite complicated, and in some ways they subsidize the productivity of city just by the way that they live and they work, because people in low income and sort of informal settlements in cities often work in their houses. So they, you cannot look at poverty, at least in an urban context, and I guess in some rural areas, without looking at all these things, at the provision of basic services, water, sanitation, proper drainage, power. I mean, you can't manufacture things without power. And power and light are very important for people to be able to study and go ahead in life and stuff like that. And of course housing, which is a significant proportion of people's monthly expenditure if they rent it, and a very large fraction of their own capital investment if they're able to invest in a house. So in a sense, dealing with multidimensional poverty means dealing with all of these questions. And very often, because of the poor environmental conditions and the impact of, let's say, inflation, in cities that do not actually have a social safety net for poor people, it means that year on year it becomes quite difficult, and in some senses you may have deepening poverty in some cases. So it's just not adequate for us only to look at calorie. Of course, the calorie question is central. And if you don't do that, you're not doing very much. If you have a house and you have nothing to eat, or you have less to eat, is not one is not substituting the other. The other question, of course, is there's been a long debate for a while about a uniform sort of global poverty line, and there is this $1.25 a day poverty line, and some people see that as the line below which people are experiencing extreme poverty. But I guess, like I've said earlier, that there are a couple of problems with that. One, of course, is that the exchange rate and purchasing power parity are quite different across many countries. So you need to at least address that. Otherwise, the comparison becomes odious, and it's you can't compare a low middle income country with a low income country, or you can't compare a high middle income country with one that is really deeply indebted. So that's the first thing. The second thing, of course, is that urban areas are more expensive than rural areas, and especially if you don't have inflation correction in your statistics, you tend to underestimate the amount of poverty. So there's been quite a debate about whether, if you use this measure, East Asia, much of North Africa and the Middle East, and some parts of Sub-Saharan Africa, and maybe some parts of South Asia actually have no extreme poverty. But both nationally and internationally, that's absolutely something that we have to address in the next 20 years, or even earlier than that if we are able to muster the energy to do it. It doesn't actually cost a huge amount of money. It's not about being able to build the systems that enable people to step out of the circumstances they have, addressing structural challenges, which are of course not easy to deal with, and then making sure that the institutional mechanisms to keep them out of poverty actually help provide that opportunity, because people in no part of the world would like to remain poor and extremely poor for very long. At least even if they've lived that life for themselves, they absolutely don't want to visit that on their children. And cities are great places to make that happen and to make the change for the better, as far as most people in the world are concerned.
Cities are a place where human health can improve or get worse, and there are many examples of both around the world. And we're beginning to realise that it isn't just about healthcare services, it's not just about having hospitals and healthcare clinics, it's actually about enabling people to live a much healthier lifestyle. And that involves improving air quality, improving water quality, improving nutrition and food supplies, and enabling people to live healthier lifestyles where they have access to biodiversity, they can walk and cycle and be more active. Very often people are moving to cities from rural areas where they have a very active lifestyle, and they move into cities, often into informal settlements, and they don't eat as much because they don't feel the need to eat as much, and they can become malnourished really quickly because they don't have access to fresh food. So one of the most important things in terms of healthcare is to enable, design the city and configure it so that people can live in that healthier way. We know, for example, that most urbanization is initially accompanied by extreme pollution, and we've seen that in Chinese cities, we've seen it in Indian cities, and we've seen it in Europe and North America in the early days of urbanization. And we've got to find ways to avoid that problem, because the respiratory asthma problems that people are going to have due to those conditions are very, very poor. So having regulation that enables air to be clean is clearly very important, and we know from the Clean Air Act in the UK that changed the situation almost overnight. So regulation on air, water, soil quality is probably one of the most powerful ways to improve those aspects. One of the really critical problems the world's facing is an increasing shortage of food supplies. And this has come about because as population has grown, we've used fertilizers to increase food production, but up until, well, about 5-10 years ago, that worked, but it's now not working because fertilizers are no longer enabling the rate of food production to keep up with population growth. So we're in a situation where we have to address that, and I believe that from the work we've done is that the connection between urban and rural systems is the answer. There's an awful lot of land in cities which we're not using very effectively. Sunlight falls in cities, we get rainfall, we have nutrients in the waste streams in cities, and that can all be recycled into food growing in cities. Not necessarily to produce all the food we need, but a certain proportion of it. But at the same time, we can provide treated wastewater and nutrients to farmers around the edge of cities for them to increase their food production at the same time. So by combining growing food in cities and increasing productivity outside the city using the resources from the city, we can actually make a very big difference on food supply and address the critical issue of nutrition and to make sure that mineral contents of food are good and that people have access at an affordable price, the sorts of foods that enable their minerals and nutrition to be improved.
A new area of focus is urban agriculture. What we are finding is that there's so many great opportunities for urban residents to participate in the food system through community gardens, through, in some cases, low-tech or in some cases high-tech food production systems. We do have to be careful though, because sometimes there are toxic soils and toxins in air that can affect the quality of the produce. So we do have to make sure that when while we're enhancing food production in urban areas, that we make sure that the food is safe and nutritious for all to eat.
If you get mortality indicators or health indicators for informal settlements, you begin to realize the incredible health disadvantage they face. In many informal settlements, infant and child mortality rates 20 times what they should be, and also 20 times what they are in the richer part of that same city. Same with maternal mortality rates. Addressing health, you can move on so many fronts. There's so many social determinants that influence health. So you can move on housing and living conditions. All the things that I've mentioned earlier. Good infrastructure, good services, secure tenure. Obviously the quality of healthcare has huge importance. Huge importance both for reducing health impacts, also for reducing the income lost to being injured or falling ill. There's also emergency services, the rapid ambulance service to get people to hospital when they face a serious illness or injury. The fire protection services that come in when there is a fire. Schemes that guarantee a little income or provide an income supplement can also be incredibly powerful for health. For instance, the cash transfers, which have become increasingly common in rural and urban areas in Latin America. There's some evidence now that, what we would regard as a very small increment in a low-income household's income, usually allocated to the woman, can enormously reduce the most extreme forms of deprivation.
From the point of view of cities, we like to put these two things together, because finally, at the local level, we start with the citizens, and the citizens are an integrated social and economic person, so we have to deal with both things at the same time. The problems at the economic or the social level sometimes are individual, poverty or basic services or housing, but the thing is that they have to be solved collectively. And I think that normally both social and economic issues go together, and also individual and collective issues. So this is a very important agenda for us, because we tend to separate when we look at those problems from the point of view of national states or even the global. We have the tendency to take a kind of sectorial approach, and this, when you go to the reality of every person in a city, that doesn't work. We have to look at it together, and in a sense we have to give the opportunity to all the people to get out of their poverty and their social and economic issues at the same time, and within their community. We have to solve that in every street, in every neighborhood, in every city, and that's done together, mixing economic development and social inclusion.
Cities are places where there's markets for everything, markets for housing, markets for water, for sanitation, for drainage, even for schools. Many informal settlement dwellers have to send their kids to private schools because there's no public schools available to them. Very poor quality schools, but nonetheless a significant cost for low incomes. Social exclusion usually builds on economic exclusion, so that those with low incomes, those with living in informal settlements, are excluded from water, sanitation, drainage, healthcare, schools. Then, if you can view social inclusion a little more positively, as you support low-income groups to organize and make their demands, learn to work with local governments, as in the federations I mentioned earlier, so social inclusion is enormously reduced.
I would imagine the simple way of looking at it is that we have to provide people with adequate livelihoods. People have to have decent jobs and the opportunity to work, because we have, by and large, for the next 20 or 30 years, a global population that's very young. And young people want to go out and do interesting things and work, and probably work very hard, and we need to give them the opportunity to do that. So that is an absolutely critical thing to do. The challenge, of course, is that our education system and the skills that people have may not be able to match the demands of the labor market, especially in cities which are becoming increasingly competitive. So building that bridge between people's education and the skills that they would need to do to get an adequate livelihood is going to be a challenging one. The second thing, of course, is that you have to be healthy, which means that you have to have adequate nutrition. And both for communicable and non-communicable diseases, we owe it to our people that we actually provide them the opportunity to live a healthy life, because if they don't, it becomes so difficult to work, support your families, and generally make life better for yourself. So developing our health and education systems to support the development of, to support human development, especially in the global south, is very, very important, because eventually it is poor people who are going to fight and make life better for themselves. City governments and national governments and international aid agencies and universities and other institutions can only help them do that. But we've seen, decade after decade, that's really what's helped people sort of come out of poverty. But there are some deep structural challenges in many societies. The most serious one, of course, is gender inequality, where women don't have access to proper education, their healthcare is compromised, and they don't actually have opportunity to go and work in the way that they would like to. And I see this changing in the next 20 or 30 years in many parts of the world, including our part of the world in South Asia. And that's going to bring a fundamental change, because as women come into the workforce, as cities become better places for women to work, become safer places to work, and better places for young children to live in, it's actually going to change the entire environment. So we have to redirect our institutional priorities towards trying to achieve these soft outcomes. Even universities have to redirect themselves to be much more responsive to the learning needs of people, and enabling them to be able to study and learn outside the normal process of, you finish school, you go to university if you're well endowed and have enough resources, and then you go into a job. Now I think we have to sort of change that paradigm. And I think the internet revolution and the fact that more and more people are connected and can talk to each other is making it much more possible for people to actually go out and find ways of doing it themselves. And just the clustering of people and the innovation that we find in cities is the way that this thing will be accelerated a lot faster than many of us would actually imagine, which is not a bad thing. The converse, of course, is that if things go into a downward spiral, then they could also spiral down quite drastically, and that's the situation that we really don't want to go to, because urban conflict is really not the place that we want to go with a few billion people living in cities. That's a place that would be rather unhappy for all of us.